About 7.5 million Americans suffer from psoriasis. For some, it's treated with a topical prescription. But for one Tampa girl, the condition was so severe, she didn't want to go outside. Gail Guardo shows us the treatment that turned her life around in this On Your Side medical report.
I had it all in my eyebrows everywhere.
9-year-old Brianna Mollenkamp is describing what it was like before being aggressively treated for severe psoriasis. The chronic inflammatory condition that affects millions of Americans had spread over Brianna's entire body, even her face and scalp.
It was horrible. Before we went to see Dr. Forman, Brianna, dead heat of summer, would wear long sleeve shirts, long sleeve pants, would not put on a bathing suit. She came home crying from school. The kids were teasing her, called her a chicken pox girl.
Frustrated with treatments and topicals that didn't improve her daughter's condition, Brianna's mom, Kimberly, went in search of a dermatologist willing to oversee more aggressive alternatives.
Not treating a disease like psoriasis leads to severe case, the risk of depression, the risk of heart disease, the risk of obesity in patients that have chronic psoriasis is overwhelming. Not treating this condition aggressively is a risk all by itself.
Dr. Forman felt he had no choice but to turn to a drug known as a TNF-alpha inhibitor, which inhibits parts of the inflammatory response, which causes psoriasis. The problem is the drug comes with a recent warning from the FDA that it might put children at a higher risk of developing leukemia lymphoma.
The problem is that chronic inflammatory diseases such as psoriasis, such as rheumatoid arthritis, such as the arthritic component of psoriasis, which is psoriatic arthritis, that can actually increase your risk alone of developing lymphoma and leukemia. So the data really isn't clear as to whether these drugs are actually increasing your risk of lymphoma and leukemia, or is this just a natural part of the disease state.
Dr. Forman believes the benefits far outweigh the risks, especially if the dermatologist stays in constant contact with patients.
With this drug, it does tend to slightly lower the immune system, so if they tend to get a fever or a cold, you stop medication until they get over this period. We have constant phone contact with Dr. Forman, the nurses. They're aware when my child sneezes.
But overall, Brianna is the picture of health, now able to enjoy things the rest of us might take for granted.
Now I can I can go swimming without anybody seeing my psoriasis.
Gail Guardo, News Channel 8.
And she's gorgeous.
Yes, every little bit helps.
That's right. We'll be right back.